My husband Hugo and I came to the Institute in 1976. At that time, the Institute was known as one of the 40 institutes in the country that were university affiliated and had training programs for the developmental disabilities. And in addition, they had a small unit where an inpatient unit where patients were admitted for periods that varied from a few days to many months. In 1976, there was patient-related research, but there was no basic research, that is, in the neurological sciences. It just didn't exist. And one of the factors that the search committee was interested in was to recruit a person, such as my husband, to bring basic research to the developmental disabilities. And so my husband, in the early years, wrote grants to bring basic research to the Kennedy Institute. And he was fortunate in getting one of the 12 basic research grants that was funded by public law for getting research to the developmental disabilities. During the time of Hugo's tenure as head of Kennedy Institute, many new techniques were developing to image the brain of patients, so that very early on, Hugo and his staff realized that they should purchase some of these, or institute the purchase of these magnetic resonance imaging instruments in order to see the fine structure of the brain, to try to understand what the patient's disability was at the brain level without invasive studies. So the MRI Center was founded during this time, and it continues to be a huge factor in the care of children here at the Institute. My husband approached the Kennedy Foundation for some money to help fund some young pediatricians, pediatric neurologists, and basic scientists in working at the Institute on the neurodevelopmental disorders. And the Kennedy family funded 6 fellows for a period of, I believe, 2 years. So it gave these young researchers a jump start in their careers. I believe that Kennedy fostered the careers of these individuals, and then they went on to be senior researchers in the field. They didn't all stay in this area. They went on, and that's the whole purpose of this idea of training individuals to work in the field of developmental disabilities. And it kind of spreads the research from the key centers to other centers around the country. The Institute has grown in size, and also the Institute has become known for being a leader in research on inherited disabilities, as well as treatments for all types of brain disease.